The state-of-the-art $1.6 billion new infectious disease hospital will now serve patients diagnosed with infectious diseases, including COVID-19. The construction of the former Ocean View International Hotel lasted for approximately 4 months. During that time, there was round-the-clock work by several contracted employees. At the official commissioning ceremony at the hospital's Liliendaal, East Coast, Demerara location on Thursday morning, Public Health Minister Volda disclosed that the idea of an all-inclusive infectious disease facility was birthed to reduce the burden on the tertiary institutions and regional and district hospitals that do not have the requisite capacity to effectively manage these illnesses. The building has a series of compartments which cater for quarantine and isolation of COVID-19 patients.
We catered for our isolation areas, our step-down care, quarantine areas, and to the western side of this building, we must now add our HEOC department, our surveillance center, our research center, and administrative offices.
Lawrence added that the aftermath of COVID-19 will see the building being used for scientific researches, among other things.
It will facilitate testing, research, treatment for identifiable and non-identifiable diseases, enhance surveillance, and even provide assistance for our neighboring countries where necessary.
The hospital, which currently has a few beds and other medical equipment, is not yet functional, as it awaits the transfer of more equipment and staff from the Georgetown Public Hospital and other institutions. Speaking on the sidelines of the event, President David Granger, when questioned about the level of expenditure for the facility, did not give insight into the cost. However, he stated that it is justified.
The person who built the hotel was heavily indebted to the banks, and my understanding is that it's in receivership. So in financial terms, we don't have a final a bottom line, but the Minister of Public Health and the Minister of Finance are quite aware of the level of expenditure, and Cabinet is convinced that the expenditure is justified given the health situation.
The Pan American Health Organization, World Health Organization, through its local representative, Dr. William Adukro, in April made recommendations to the Ministry of Public Health to establish a designated COVID-19 hospital. At the time, the International Health Agency projected 20,000 cases of COVID-19 in Guyana. Temika, Rodney reporting for the HTP Nightly News.